If you have been struggling with substance abuse, you know that it's extremely difficult at times to overcome. You also may know that there's people here in the Valley who can help. This year, especially, has seen an uptick in substance abuse, and SilverSummit Healthplan is standing by to assist you in recovery.
Absolutely. Dr. Jeff Murawsky is the Chief Medical Officer at SilverSummit Healthplan. He's joining us now with more. How are you, sir?
I'm great, thank you, and thanks for talking about this important topic.
Of
It's
course.
been a rough year, with the pandemic and kind of starting to wind down now. We're really noticing that about 10 to almost 20% of people have seen an increase in substance use, and that can lead to substance use disorders. And so we really want to make sure people are aware of it, that we have a outsource and we get help to do that.
Absolutely. And we've seen the numbers obviously increase with substance abuse disorder. Explain the trends that you're finding across certain populations.
Yeah, it's interesting. It starts with kind of unhealthy use and then moves on to kind of you get farther risky use, and then you get into substance use disorders. And the populations, unfortunately, we've seen this disproportionately impact pregnant people, and it's really
Ooh.
important to get care during pregnancy.
Hmm.
We've seen it impact people who have more stressors in their lives normally, people with what we call the social determinants of health, people who have to struggle harder, people socioeconomically disadvantaged, people that are ethnically disadvantaged or racially disadvantaged, people in rural areas that don't have access to full care. It goes up even more in those. And with a pandemic, people under more stress, right? We had homeschooling, we had home working, we have the transition back to whatever work is going to look like. All of that raises it, and that means these populations are more likely to have trouble.
I mean, it is important to recognize trends in certain areas of the population. And yet, I think one thing I've learned in my lifetime about substance abuse is no one is immune for it. It doesn't matter what socioeconomic class you come from, what background that you
Does
have.
not.
These alcohol, the drugs, the prescription
Mhm,
painkillers, they grab a hold of you as a person. Can you
mhm.
talk about some of the substances, some of the struggle that you see
Yeah.
most people have
Yeah,
turned to during
yeah,
this time?
you bring up a great point. It's so many different substance use disorders, right? There's alcohol use disorder. In Nevada, we had one of the worst rates of opiate use disorder. We've done a lot to bring down our prescription misuse of pain medicine, but
Okay.
that's still a major factor. While marijuana is legal, it can be misused, and so we've seen that continue to happen. And then we've seen kind of this the synthetic and illegal substances like the illegal fentanyls and heroin come back
Yeah.
in our community. All of these things make a big impact on people's lives, and all of them, you need to get help.
Yeah, no question about it. And especially considering the past year and change, where all of our lives have been kind of thrown into a blender. I mean that the numbers have just have skyrocketed over the past year.
Yeah,
Sure.
and telehealth helped, right? We were able to even connect with some people through telehealth that we may not have before. And now we're kind of seeing, oh my goodness, you really are struggling. Let's get you help. Let's get you connected. It can be small stuff to big stuff.
Absolutely. And I think, I know you wanted to discuss some of the signs of abuse. And I think that in my life experience, it's not only important to discuss these for the person who is addicted, but also for all the people who are affected, because that's one of the
Mhm.
most tragic things about substance abuse is all the family, all the coworkers, the neighbors
Yeah.
who are, negatively affected when someone is struggling with
Mhm.
addiction.
Yeah, I mean, everybody around that person in their entire circle is impacted. And we can all look for signs and symptoms, being withdrawn, major changes in behavior, people who just don't look like they're themselves. Looking unhealthy can be a sign of substance use disorder, not eating well, not sleeping well, not getting around well. You can have people that withdraw and don't let you into their space. That can be a sign. And so it's really important just, to ask if people are okay and to always remind them they can talk about all of the issues that they have with their doctors.
No question. Speaking of, before we go, doctors, we want access to them. Medicaid, open enrollment
Mhm.
happening now through the end of the month. Why is this such an important time?
Well, it's a great time to pick your plan on Medicaid and the Silver Summer Health Plan. We're here to help keep you healthy and help you get to the right care. www.silversummithealthplan.com has lots of great resources on it about the plan and about getting mental health help.
Awesome.
Awesome. Dr. Murawski, always a pleasure to talk to you. Thank you so much for
Great
joining
to
us
talk to
today
you.
and for, asking us all to take a deeper look at our health. You do that every time you're on. So thank you.
No question
Thank
about
you.
it. SilverSummitHealthPlan.com if you'd like to learn more. Open enrollment for Medicaid going through June 30th. So go there, get some more information, empower yourself, and make the right choice. Silver Summit Health Plan, proud sponsor of the Morning Blend.